Hey, welcome to Point A. Just want to do a quick follow-up video. Last week on my filters series, I talked about the importance of filters and the kind of influence they have on how we experience our lives. A lot of questions came up regarding physical filters, specifically low back pain, so I brought in the expert, Dr. Kevin Andrews, to talk about the interplay between key elements of low back health and what we can do, especially in our careers and our personal lives, to maintain that crucial piece of health. So Kevin, a couple questions for you today.
Sure.
I struggled with stability for a long time in my low back, and I was curious if you could talk about the interplay between alignment and stability.
Absolutely. So alignment and stability, they really go hand in hand. Okay, so if we look at just alignment or we look at just stability and we try to break those two things apart, it's almost impossible to do. Because without proper alignment, we can't have good stability. And without good stability, proper alignment is almost impossible to maintain.
Got it.
So those two things really kind of go hand in hand.
So they are connected.
Absolutely.
Can't have one without the other.
Correct, yeah.
Okay. So what would be the things that will have a negative impact on one or the other or both?
Sure. So there's a lot of negative impacts. You can look at, your basic work habits, the ergonomics of your desk or your workstation. Repetitive use injuries that we see either from work or also from just sports or habits, daily use or your sleep patterns. But then also old injuries. A lot of people forget, hey, I had a car accident 20 years ago. Well, that may have caused some permanent damage that could absolutely affect your ability to find that proper alignment and maintain stability.
Got it. So if we're not holding position, definition of stability, our hopes for alignment are pretty low.
Absolutely.
Okay, got it. And then past, present, future all contributing to what we're dealing with here.
Absolutely.
Got it. Okay. So what do we do about this? What are some things we can do to support, create, manifest stability and alignment?
So first and foremost, in my experience, I found the best thing to do is to identify the issue, okay, or issues if there's multiple things going on. Without proper diagnosis and without knowing exactly what we're working with, we can't really come up with a plan of attack. Okay, but once we do discover exactly what's going on, what the issue is, then we can come up with that plan of attack that we need. So we're going to look at whether it's a passive therapeutic treatment through a massage therapist or an acupuncturist or a chiropractor or a physical therapist or exercise therapist, whatever it is, to help eliminate some of those basic issues and basic movement patterns that we need to improve. And then long term, what we want to look at is some type of exercise program that's going to work for us. Now, of course, there's so many out there. Most important is you want to find an exercise therapist, a personal trainer, a chiropractor, a physical therapist, somebody that truly cares and somebody that understands what the issue is and how we can address that issue. So it's those exercises long term that's going to help prevent those issues from coming back and help us maintain that balance between alignment and stability.
Makes sense. And if I'm hearing you right here, this is often a situation where we didn't get there overnight.
Correct.
Hence, the solution is probably not overnight.
Usually,
fair to say.
Yeah, that's definitely fair to say. And a lot of these things that they occur because of patterns that we have in our work life or in our normal life or by playing sports or some people work on an assembly line and do the same movement 1,000 times a day, and you multiply that over how many days they work per month and per year. That's a lot of overuse for that one part of the body and creates a lot of imbalance. But then you also have people that have been perfectly healthy their entire life and they have a ski accident, and they blow out a knee or part of their back. And all of a sudden now the balance and the alignment for the rest of their life is going to be a little bit of a challenge unless we really get after it by trying to build up muscular balance between the body left and right, front to back, and everywhere else. So that's what I found to be the most successful.
Makes sense. All right. Well, good stuff. Thank you for joining today.
Yeah, you're welcome.
And hey, folks, again, I'm with Kevin Andrews, Doctor of Chiropractic here at True Health and Fitness. Any questions, look us up here on the web, truehealthandfit.com.
That's correct.
All right. And then you can reach me at pointacoachingandconsulting.com. Thanks for tuning in. We'll see you next time.